This is a patient that underwent ACL repair. Here you can see the ACL is pulled directly off of the wall. Has good tissue. At this point, we're putting a Stedman awl to allow a bit of a microfracture for a better healing of the ACL and incorporation. I then take a knee, actually this is just a regular scorpion, and pass a fiber wire back and forth. Generally, I use about 3, occasionally 4 passes, starting at the base and moving more proximal. I do it going both medial to lateral and then lateral to medial, having essentially the middle of the fiber wire at the base of the ACL with 2 strands coming out at the apex. I like using 2 strands rather than 1, so I can have more fixation in the actual ACL itself, and then I'm able to tie the 2 strands over a bone bridge as I put 2 tunnels, 2 very small tunnels, I would say, into the wall in roughly the anatomic location. This is my shaver at this point, roughening up the wall, removing soft tissue debris. I then use a guide wire, the same one you use for the tightrope, and I put that in the PL location. I then pass a suture, and I pull my more anterior of the sutures in the ACL out along with the tightrope with an internal brace attached to it. We then pull the tightrope all the way through. We do confirm with fluoroscopy that it is directly onto the bone and flipped. Pulling that in can be a little bit difficult. Then I drill using a flip cutter without flipping it, and I drill into the most anterior part of the ACL and the tibia so as to not get it into the ACL footprint itself. And then I pull the internal brace down, and we fix that towards the end. I then take the guide wire or the drill again for the tightrope, and in roughly the AM location, I drill this all the way through, pass the suture, and then I'll pass essentially my more posterior or more proximal of the limbs of the suture that was passed through the ACL. Here you can see that being done. So once we pull that through, that pulls our ACL directly to the wall, and it should be anatomic at this point. And here you can see the internal brace. We'll pull that off so that actually fix it in place. And you can see this is viewing from the medial viewing portal. You can see the ACL itself. Here, as I'm pulling tension on the ACL, we have nice tension on it. It pulls it directly to the wall, pulling the internal brace aside, and then this is taking one last look at it. We fix the internal brace at roughly full extension and make sure we check range of motion afterwards.